Hello, everybody. Welcome to today's webcast. I just want to let you know we'll start the presentation in about 1 minute. Thank you for joining us. Hello again, everyone. Thank you so much for joining us. Just to let you know, we'll start the presentation in about 30 seconds. An official hello, everyone, and welcome to today's Safety and Health Magazine webcast, Beating the Heat, How to Keep Your People Safe from Heat-Related Illnesses, sponsored by Velocity EHS. This is Alan Ferguson. I'm Associate Editor with Safety Health and co-host of the On the Safe Side podcast, and I'll be moderating today's event. Once again, thank you for joining us, and before we get started, there are a few housekeeping items. As a disclaimer, the views of today's speaker and organization are their own and do not necessarily reflect those of the National Safety Council or Safety and Health magazine. Any mention of a commercial enterprise product or publication does not mean the council of the magazine endorses those items. After today's presentation, we'll conduct a question and answer session with our speaker. If you have a question, click the Q&A button at the bottom of your screen, type your question, and press the send button. You don't have to wait for the Q&A to begin. We might not get to every question, but the good news is unanswered questions will be forwarded to today's sponsor. Also, after this presentation, we'll be asked to complete a brief evaluation survey, and I'll tell you more about that a little bit later. Just to let you know, this webcast will be archived so you can access it after today's live event. To view this webcast and all of our past webcasts, please visit safetyandhealthmagazine.com/events, and you may also receive a link in our post-event email. With that, let's introduce our speaker. With us today is Greg Duncan. Greg is an EHS and ESG expert with Velocity EHS and focuses on giving EHS professionals information and insights that help them effectively manage compliance and risk and build safer, more sustainable workplaces. Before joining Velocity EHS in 2016, he worked for 6 years with the National Marine Fisheries Service and the Alaska Department of Fish and Game as an onboard compliance monitor on commercial fishing vessels and at shoreside processing facilities. Greg holds a master's degree in environmental law and policy from the Vermont Law School and a bachelor's in biology from the University of Illinois. Greg, whenever you're ready, go ahead and take it away.
Wonderful. Thank you, Alan, and welcome everybody. Thanks for joining us today. All right, so without further ado, let's dive right in. Of course, we've had my introduction, and before we begin, I just want to tell you just a quick mention about Velocity HS. We are an environmental health and safety software company, and our Accelerate platform is our flagship product. It includes capabilities for safety, ergonomics, chemical management, operational risk, as well as functionality for contractor safety, environmental compliance, industrial hygiene, and sustainability. All integrated into a single platform with great visibility of your data and EHS program performance, user-friendly design, and a centralized system architecture. I don't want to talk too much about our products. I'd rather get on to the more important things, and that includes today's presentation goals. First thing we're going to cover is heat-related illness risks and trends to kind of help set the stage for why this is such an important topic, and why we're all seeing a lot of activity from a regulatory standpoint, as well as, from, professional organizations and thought leaders in our space around heat-related illnesses. And to that point, we're going to talk about some of the current regulatory activity that's going on around heat-related illness prevention and heat illness standards. Then we're going to do a little bit of a pre-med lesson here. We're going to talk about heat-related illnesses, types of illnesses, their symptoms, health effects, and then also treatment precautions and treatment measures that you can take if you experience these or if your workers experience these on the job. And then we're going to talk about at a more higher program level what you can do as EHS professionals to help prevent heat-related illnesses in the workplace from the get-go. And lastly, we'll just take a quick look at how technology can support those prevention best practices. All right, so as I mentioned, we're going to set the stage by talking about some of the current and ongoing heat-related illness risks and trends. As I'm sure you're all aware, it does seem like it's getting a little bit hotter, and the data supports this. The chart on the left shows average temperatures over the past 120 years or so, and we do see a notable increase in the average temperature going up ever so slightly. And on the right, we're seeing incidents of days over the average temperature in different regions throughout the United States. Obviously heavily located on the West Coast and in the South, but also on the East Coast as well. Various areas of the country are experiencing temperature increases at different rates, but it's all something to keep in the back of our minds as we start to think about why we're seeing heat-related illnesses continue to trend upward. Some other data to help kind of paint the picture of risk that we're seeing. We're getting an increasing number of temperature record highs coming from the 1950s and steadily increasing up through today. Um, and then, different metrics of heat and heat increases, things like heat wave frequency and duration, the length of the heat season or the hot season across the United States, and the intensity of those are all trending upwards. And this is not just true in the United States, it's true globally. We're seeing different regions throughout the world experiencing high rates of worker exposure to heat risks and heat illnesses. Obviously, places like the Middle East and Africa are experiencing high increases in worker exposures to heat risks and heat-related illnesses. But even, in places that you wouldn't think would necessarily be that high of risk, like Europe and Central Asia and some of the upper latitudes, we are still seeing, in fact, like in Europe and Central Asia, the increase in worker heat exposure is actually double the global average. And so a lot of climate dynamics at play here, but the general takeaway is that workers everywhere are facing increased risks of heat exposure and heat-related illnesses. Looking specifically at the United States, we've got some hard numbers to kind of back up this trend. I believe it's going all the way back to 1992. In fact, the United States has documented an average of more than 3,000 occupational heat-related illnesses each year, and that includes, tragically, an average of 33 fatalities. And this is, I just want to remind everybody, these are only the recordable injuries and, of course, the occupational fatalities that are reported. Many studies point to unfortunate incidents of underreporting, especially of heat-related illnesses. For example, some state-based surveillance systems that follow these trends a little more closely within their respective states are seeing multiple, 5 to 10 times more cases than the overall um, national averages. And then, we're seeing severe incidents of underreporting. Why? Because I think heat-related illnesses in particular are generally not viewed as severely as some other recordable types of injuries or illnesses. There's also some cultural factors that are going on there that can contribute to underreporting. And, this all just kind of paints even further picture of the risks that workers are facing during those hot months. And it's not just outdoor workers as well. This includes indoor and outdoor workers. And I think indoor work is something that we need to pay special attention to. We have a little bit more control over because it's an indoor environment. It's a more closely controlled work environment. And so we have an opportunity there to really, make a dent in the impact of the heat-related illness risks and the numbers that we're seeing with prevention best practices, which we'll talk about a little bit later on. Um, just to kind of break this down by industry, we are seeing the highest numbers of heat-related illnesses and days away, recordable injuries or recordable illnesses. Interestingly, in the trade, transportation, utilities industries, you would think maybe construction would be the highest, but that's actually not the case. In transportation, utilities, we have a large percentage of workers who are not only outdoors, but are also working remotely in remote locations where supervisors don't always have direct oversight of whether or not heat hazard controls are in place, or whether heat prevention practices are being followed. And so that might be a contributing factor there. Interestingly, manufacturing environments, indoor work environments, typically have a higher incidence of heat related illness than construction, which at first glance you would think would be the most high risk industry. So just some interesting things to kind of think about there. So now that we've kind of seen a little bit about the rising risks that workers are facing from heat stress, we want to try to make sure we understand the impacts of that risk, and this comes in the form of heat-related illnesses. So identifying, understanding, and being able to treat these effectively, quickly and effectively, is really the name of the game. So at a very, kind of minor, it's all relative, but at a minor level, the the first signs of heat-related illness often onset with dehydration or are the result of dehydration. And so we've all experienced this, I think, at one point in our lives. The symptoms of dehydration. Um, and as we go through the next few slides talking about different heat-related illnesses, it's really just important for us and for our workers to understand and be able to recognize the signs, because if they don't know what to look for, uh, they can go overlooked, and then it just kind of escalates from there, and the condition and the impact of heat stress gets worse and worse and worse. So making sure that we understand the signs of dehydration, as well as heat rash, is kind of the first canary in the coal mine, kind of when it comes to these heat related illnesses. There are multiple types of heat rash. All of them, these are kind of progressing in level of severity, but all of them should be a clear sign that there's the onset of a heat related illness. And so taking steps early on, before it can escalate, is really the key. And once things have escalated a little bit, the health effects become more and more severe. Heat cramps being, one of the more severe impacts of dehydration and heat stress more generally, and this is where work can actually, be affected. Workers can become less able to do their jobs when they experience things like heat cramps. And so, if you've got heat cramps, or if your workers are experiencing heat cramps, it's important they understand the signs and knowing what to do in order to mitigate that. Because heat cramps can, if left unchecked, can quickly escalate into heat exhaustion. And this is where we're really starting to get into the red zone when we're talking about heat-related illnesses. This is a escalation or an increase in the body's core temperature, and we're starting to get impacts to the physiological systems of the human body, and they can be debilitating. They often are. So if you unfortunately get to this point where you're experiencing, or workers are experiencing, heat exhaustion, we really need to be quick about intervening and doing things like getting the worker into a cool place, hydrating, just trying to get that core body temperature back down to the normal level, because if it doesn't, it's only going to get worse from there. And heat exhaustion occurs when the body is the normal sweat response uh, doesn't function anymore. The body loses its natural physiological ability to cool itself, and once that happens, it's kind of like we're going off of a cliff, and it's only going to get worse from there unless we intervene. If we, fail to recognize these signs, if workers fail to recognize these signs and take action, it can quickly turn into heat stroke. Heat stroke is the most severe form, immediately severe form of heat illness, and it actually, it results in a severe fever in effect, which can damage body systems, it can damage organs, and so if left unchecked, it can ultimately result in death. So recognizing the symptoms that we see here, and then, more than just moving a worker to a cool place and trying to get their body temperature down, that's time to call 911. If you get over that 104-degree break point for any significant amount of time, like I said, it can cause organ damage and organ failure, brain damage even, and then death. So this is serious. Um, and there are other types of heat-related illnesses as well. One of the other common ones is called rhabdomyolysis. This is more typically involved or associated with athletes, but it can occur with strenuous work in hot work environments. What actually happens is the muscles begin to break down and they release toxins into the bloodstream that can cause organ damage, organ failure, and ultimately it can result in death as well. This is only diagnosed through a blood test to determine the presence of these toxins, this creatine kinase in the blood. So it's hard to detect, but knowing the signs are, very similar to other, more minor or moderate heat illnesses, but it can be fatal. And so, any combination of these things can occur as well. You can be experiencing heat stroke and rhabdomyolysis all at the same time. And then that just increases the risk to the worker's life. All right, so that's kind of a crash course in heat illnesses. We're going to go to our first poll question, which is really more of a knowledge check. Make sure you guys are all tuned in. Which of the following choices is the most immediately severe form of heat illness? So go ahead and pick which one you think is the most severe, and we'll check our answers in just a few minutes, or just a few moments. And I just want to specify for this question, the most immediately severe form of heat illness. That's kind of key to the question here. So, yeah, hopefully um, folks are chiming in. And yes, here's our results. Excellent. Yeah. 86% of you, or 81% of you had it right. Heat stroke being the most severe form of heat illness. So, this is kind of the end of the line. There's nothing beyond heat stroke except for fatality. All right, we'll go ahead and close that and we'll keep moving. All right, now that we've understood some of the heat risks and heat illnesses that workers may encounter in the workplace, now we're going to talk about some of the regulatory activity that's going on around heat stress, heat illness prevention standards. And we will be focused, kind of heavily on the United States. I think that's where a lot of our audience is based. There are many heat illness prevention standards in places like Canada and throughout the world, but we're going to focus on the US a little bit for today. The first thing I want to talk about is OSHA's Outdoor and Indoor Heat Hazard National Emphasis Program, or NEP. And this is really kind of what's been kicking off a lot of the origin of a lot of regulatory activity in the United States that we've seen over the past few years. Back in the April 2022, OSHA launched this NEP, recognizing some of those risks and injury and illness statistics that we looked at a little bit earlier, and saying this is a severe hazard to workers, both indoor and outdoor. We should take action. And so What the NEP does is essentially set up a targeted inspection program, and OSHA inspectors were beginning to go into workplaces specifically looking at heat hazards. And since 2022, back through about this time last year, OSHA had actually, in the period of 3 years, well, actually 2 years, really, performed over 5,000 inspections directed through this national emphasis program. Um, and these are coming both from programmed inspections as part of programmed inspections, but were also the result of worker complaints that they had received. And OSHA is citing these under its general duty clause. Um, that general duty clause basically says workers need to maintain a work environment free of hazards and protect workers from hazards present in the workplace, and heat is included. And so this is, from my perspective, this has really been one of the most extensive and aggressive uses of the general duty clause to pursue any hazard for which there is not a specific standard. Um, and this continues. This is still in effect, and it doesn't seem to be going anywhere. So it's something to keep on your radar as an employer and as an EHS professional. How are they targeting these inspections? Well, they're really relying heavily on National Weather Service data and alerts to kind of trigger these inspections. And so any National Weather Service heat advisories or heat wave alerts or excessive heat warning alerts, which you see the criteria for here, those are going to be what prompts OSHA inspectors to get out and start going into workplaces. Um, Now, they're not going to every workplace. They're targeting the specific industries listed in the NEP, and we're going to take a look at that in just a second. And then this is true for, I think, a lot of other agencies and other OSHA standards. Actually, is if they're receiving referrals from other agencies. Let's say you have. You know, somebody from the Wage and Hours Division of the U.S. Department of Labor. If they make a referral for something that they've seen, they'll refer it to OSHA. OSHA will then go into that same workplace and begin an inspection targeted around heat hazards. And that those referrals can come from any other federal agency that might enter your workplace. So here's the list of industries that are targeted under the NEP. It's a long list, but what we can basically see is a lot of manufacturing sectors, a lot of wholesale sectors, wholesale merchant sectors. So these are warehousing, um, trucking and transportation, other types of transportation, basically anywhere where workers are outdoors for the bulk of their work day, as well as some other types of industries. This list builds on that. This is a continuation of that list. This is specifically related to construction type industries. Basically, all construction industries, industry sectors are targeted under the NEP, as well as agricultural sectors, and a few others here. Interestingly, we've got things like office administrative services, business support services. You wouldn't expect those to be targeted under this NEP, but even as I mentioned earlier, indoor and outdoor work environments are covered under this directive. And what they'll do, in addition to using the criteria laid out in the NEP, they're going to look at your records. They're going to look at your injury and illness logs, OSHA 300, 300A, 301 reports to see if you've had any heat-related illnesses that have occurred in the past, whatever the look back period might be. And if you have, that is kind of a trigger for them to begin looking at what precautions you have in place, what hazards might be present in the workplace concerning heat hazards. And of course, if workers complain, a report to OSHA that there is a hazard present, they're going to look at that very seriously as well. Okay, so like I said before, that NEP is really kind of the origin for a lot of other requirements, and this includes OSHA's recent heat injury and illness prevention in outdoor and indoor work settings proposed rule. Now, I'll caveat this by saying this is still a proposed rule, and there's some doubt over whether or not OSHA will move forward with it. But having looked at kind of the activity, the very recent activity that's been going on around this proposed rule, I think that it will be moving forward sooner or later. Um, so basically, at a very high level, the requirements of this federal rule would be for employers, covered employers, to develop a heat injury and illness prevention plan, or HIP. We're going to use that acronym a lot throughout the remainder of the presentation. And that written HIP needs to specify a lot of different things that you're doing or that you need to do in order to prevent heat related illnesses, including hazard monitoring, worker training, hydration, and other controls. Um, and also your emergency planning, emergency protocols, training, and record. We're gonna cover this in more detail in just a few. Um, but the reason why I'm confident that it is going to go through or become a final rule um, perhaps soon, is that between June and July, just this past month, OSHA held more than a dozen public hearings on this proposed rule. Um, I don't think I've ever seen that level of public hearing and engagement from the agency on any proposed rule before. And so this suggests a real motivation at OSHA behind this requirement. And so um, you know, this is likely something we're going to need to be concerned about at a federal level. Regardless, there are state level standards out there, and these are both, if you're in those states where they are required, things that need to be on your radar. And if they aren't, it's time to get up to speed now. And even if you're not in a state that's required, these provide a really great model for setting up not necessarily compliance, but setting up prevention best practices for your workplace, whether it's required or not. Here we see a couple maps. The one on the left shows in blue US states where there is a current, whether it's indoor or outdoor heat related illness standard. This includes, basically all the West Coast, Nevada, Colorado, Minnesota, and Maryland. The graph on the right shows all the states where there is pending legislation around whether it's an indoor or outdoor heat illness standard. The reason why California is represented on both of these is because currently there is an outdoor heat related illness standard in California, and they are working on an indoor heat related illness standard. So if you're in any of these states, whether the requirement is in effect already or is in process, these are things that you need to have in mind. So this chart shows just a brief breakdown of some of the big states where standards already exist, whether or not they are for indoor or outdoor or both settings, and then the heat triggers. Now, these are two important figures that I want you to keep in mind as well. These are the lower and upper action levels or action limits for whether it's ambient temperature or adjusted heat index temperature at which the standards kick in. And there's, in virtually all cases, there's two tiers of requirements at this initial or lower action level, and then at the higher or upper action level. And they're all kind of oriented right around that 80-degree level for the lower action level, and around 90 degrees for the upper action level, depending upon what state you're in. California having even lower upper action level than most states. So, for example, in Oregon, the requirements state that you need to do all of these things at the lower action level, the 80-degree level. But then once that upper action level is reached, you need to do additional or you have additional compliance responsibilities. And so, we can't control the weather, so we always need to be prepared to accommodate um, the requirements at that upper action level, especially as temperatures continue to rise nationally and globally. Okay, so I know you might be wondering, what what do I have to do? I don't necessarily know what requirements apply to me at this point. But if you're in any of those covered states or any of those covered industries from the NEP, you want to make sure that you're prepared. And so this really starts with having a heat related injury and illness prevention program, or HIP. It is a core requirement of virtually every state uh, heat illness standard, and is a requirement of the OSHA proposed rule. And you want to view this as part of your overall health and safety program in the workplace. It's not just distinct, it's not separate, and oftentimes there's a lot of overlap between your existing EHS management processes and tasks and what is required under a HIP. And so making sure that they're integrated is going to reduce duplicity. It's going to maximize your resources and make sure that you're leveraging your existing systems and existing processes to manage heat illness risks. And like any other EHS program, it is most effective when you have strong worker involvement, participation, and buy-in, as well as top-down management commitment. Okay, and now we're on to our second poll question. And before we start our discussion of all about hips, I'm curious, which of you already have a hip in place? And whether it's no, we don't, or yes, because it's required by a regulation because we're in one of those states, or maybe we're in Canada and several provinces who have heat illness prevention requirements. Maybe you have a hip, but it's not because it's required, but just because you're exercising best practices, or maybe you're not sure. So take another, few moments to answer the question, um, and then I'm really interested to look at the results here, um, because it's such a loosely or sparsely regulated uh, risk or workplace hazard. Whether you have one or not will be interesting. And this is indeed interesting. Yes. So we've got about, roughly equal proportions of our audience today saying that they don't have one, that they are required because that they have one because they are required under regulations, or they have one because they're doing right by their workers and making sure that they're protected. And then a small amount saying they're not sure. Well, that's all right, because if you have one whether let's say you don't have one in place, what we're going to cover next is how to build one and everything that goes into it. And if you do have one in place, we're going to talk about things that maybe you're not covering currently that you can add to your program to supplement it and make it more effective. So, according to regulations and according to EHS best practices from organizations like NSC, a HIP should contain the following 7 essential components: program scope, a definition of or identification of responsible personnel, and establishing the systems that you'll use to manage your heat illness prevention program, your hazard assessment procedures, methods, your heat hazard controls, and whatever applicable compliance requirements you might be covered under, your heat illness emergency response and planning processes and procedures, your training program to educate workers on heat illness risks and how to respond, and then your record keeping systems for documenting heat related illnesses. So we're going to go through each one of these relatively quickly. Program scope. It's just like it sounds. You're defining which work activities at which locations are covered under your HIP. And now this is going to be which jobs and which locations are covered is going to be determined by your industry. As we saw that list from um, the NEP earlier, and there is a similar list built into many of the state and federal standards. The work environment, whether it's indoor or outdoor, what work activities are being performed there, and whether or not those work activities involve exposure to heat, in whatever environment, as well as the exposure duration. Written into many of the standards are provisions for, what percentage or number of hours a worker is performing work under these heat stress conditions, and that can also trigger when the requirements kick in, or when you need to have controls triggered, as well as just the overall heat illness risk. And we're going to talk a little bit more about that when we get into our discussion of evaluating heat hazards and assessing heat illness risks. The second part of your HIP is to designate and assign responsible personnel and to identify the systems you'll use for managing your program. Of course, you need to have responsible, competent individuals in charge of developing and implementing and maintaining the plan, and these are likely also going to be the same individuals who are responsible for monitoring compliance where requirements exist, or making sure that required controls or specified controls are in place and functioning. You know, a very basic example, making sure that water coolers are filled. Um, you know, that's the kind of thing that people will be responsible for. And along with that, you need to have systems in place to make sure that those people are performing the tasks and implementing the policies, and distributing notifications and performing the reporting and record keeping as required under the plan. And so having some sort of a system to manage all of that is part of this. The third is your heat hazard assessment procedures. You really want to spell this out clearly in your plan. It needs to be written and documented how you're going to evaluate those heat hazards in the covered work environments that are laid out in the scope of your plan. Um, the real big thing to take away on identifying heat hazards is measuring the temperature. That's, we talked about before, with that lower and upper action levels. That's when things kick in, um, whether you're under regulations or not. And so making sure that you have accurate methods for measuring and then documenting that temperature reading is really critical to evaluating the overall heat hazards. You also want to make sure that you're considering other factors like um, other environmental factors, um, clothing, the particular workload or level of exertion of a covered job, and also, as we'll talk about a little bit later on, the fitness and overall heat tolerance and acclimatization. Acclimatization, that's another big term we'll talk about later. Basically, making sure that workers are, suitable for the jobs that they're performing. Just as a reminder, always make sure you are assessing and measuring temperature where the work is performed. Do not rely on the morning newscast to determine whether or not you need to have these compliance requirements and these specified controls in place. So, how do we kind of get ourselves into the ballpark for determining whether or not a job has heat hazards, heat stress hazards, and whether or not we need to implement any sort of precautions and controls for that specific job in that specific location? Well, one way is to use the heat index from the National Weather Service. This is a fairly reliable, semi semi-qualitative, or I should say semi-quantitative way of measuring whether or not you're going to have heat hazards present for a specific job in a specific location. And as you can see, you'll notice where you start in the top left-hand corner. um, we start to see indication of caution at that 80 degrees. That's our lower action level. And then we move into a higher level of caution, the extreme caution range, when we hit that sort of 90-degree mark. So anything beyond that is deemed, extreme or severe caution, and that demands the highest level of precaution and control. Um, but this is just to get us, into the ballpark, as I said, and whether or not a heat hazard might be present. What we really need to do is to measure the temperature the adjusted temperature specifically using a device, and that is our wet bulb globe thermometer. And so the reason why this is the required and preferred device for measuring that is because it doesn't just measure ambient air temperature, it also measures potential for evaporative cooling, which is indicative of the body's ability to cool itself through sweating, through the sweat response. And then we also have the black globe thermometer to measure radiant heat, because if we're standing next to or working on, a sheet metal roof, we're going to experience a lot higher temperature than we are if than the ambient air temperature. So having the wet bulb globe thermometer to measure that temperature where work is performed is how we accurately determine whether or not heat hazards might be present. So in addition to measuring that wet globe bulb, wet, wet bulb globe temperature, we should also be accounting for other factors besides that, including, sun exposure, airflow and ventilation, exposure duration, physical exertion, work environment, acclimatization level, and worker fitness. Well, how do we do all this? Well, we need to factor it into our overall risk assessment, and we can do that through a job safety analysis. So we look at an example job safety analysis, and we can see, we've got different the ability to classify risk uh, risk level based on a number of different categories that um, adjusted temperature from the heat index from the National Weather Service is one factor in that, but then there are other factors that I just showed you, clothing, level of exertion, other factors that can all be accounted for within the JSA, ultimately giving us a cumulative risk score or risk level that will help us to prioritize which jobs to control first. It'll help us to determine the appropriate levels of controls that we need to have in place for those particular jobs, and ultimately allow us a systematic method for documenting heat hazards and ensuring that we've got those controls in place. Because when we select controls within the JSA, we can assign them to a specific individual to monitor, and then we can measure their effectiveness thereafter, and we get a initial and a residual risk score so that we can determine whether or not the controls we've chosen are reducing risk to an acceptable and safe level. And moving right along to that, that goes hand in hand with selecting the right heat hazard controls. Of course, where regulations cover your business and cover your jobs and locations, you need to make sure that you are implementing the prescribed controls. But where you do not have regulatory requirements, you always want to make sure you're doing that, like using a JSA to evaluate what the risk level is, so you can select the most appropriate controls for those jobs and for those workplaces. We should always consider the possibility and the feasibility of implementing multiple controls, and also consider things like the fact that PPE, if somebody has to wear a respirator, that can impact their metabolic rate. It can impact their heat tolerance, their respiration, and this can contribute to the incidence of heat illness. And so, make sure that you're cognizant of these things as you select the appropriate controls. And always make sure, in fact, put systems in place as part of your systems within your HIP, a method and a process for workers to report issues when it comes to uh, symptoms of heat hazards or heat illness. Again, make sure that when you're implementing controls, you're always looking at the most effective controls feasible. Now, where heat is concerned, we don't always have the ability to eliminate or substitute the hazard. We don't control the weather, as I said earlier. So we really need to lean on our engineering, administrative, and PPE control types. And so we see some examples here. Always consider multiple controls where possible. I mentioned acclimatization earlier, and acclimatization is an administrative control. Basically, it is slowly, gradually introducing workers to a hot work environment to build up their heat tolerance level, so that they can, work safely. This is, it kind of sounds a little haphazard, but it's a legitimate way of getting your workers fit for working in hot environments, or with coping with heat stress. Basically, you want to work workers up to a level of fitness. For new workers, it's usually 1 to 2 week period. For previously acclimatized workers, you can kind of curtail that duration or that interval a little bit, but just the notion of gradually building them up so that they have a greater level of heat tolerance. And as I mentioned before, always consider the feasibility and possibility of multiple controls. The more controls that we have in place, the greater the barrier between the heat hazard and the worker. All right. The next is our heat illness emergency planning and response. This is a required element under virtually all existing state federal standards. The proposed standard, I should say, for the federal, in the case of the federal standard, you need to, in short, make sure that you have the procedures laid out, spelled out in your HIP for what you're going to do when you experience, or if a worker experiences a heat, a heat emergency. So basically, any heat illness, where there's a possibility for a risk to their life. Um, Making sure that everybody knows this procedure, knows who to call, who to contact, who to notify, what to do, where to go. This all needs to be spelled out clearly in your HIP, and it should also be, I should note, should also be included in any other, broader workplace emergency planning and response, or response and planning documentation. Um, and ensuring that workers know what to do, is really how to respond is the big thing. So this goes back to some of the treatment measures that we saw with our heat-related illnesses like heat exhaustion and heat stroke, making sure that we are following all of these steps and precautions. Not just nice to have, but we need to be doing all of these things and verifying that they're done in the event of a heat emergency. And so, having this protocol on hand in the workplace in the event of a heat illness emergency, whether it's through some sort of an inspection checklist or just being able to retrieve that document quickly, is really critical. The next is your training program. The training program should cover pretty much everything that we've talked about up to this point: heat illness symptoms and signs, treatment methods, emergency plan procedures, knowing what to do, who to contact, where to go in the event of any sort of heat related illness or emergency, is really critical. And supervisor training should go above and beyond this, above and beyond the training that you would provide to your average worker, because your supervisor in many cases be your responsible individuals or your competent persons who are responsible for implementing and monitoring and maintaining your HIP plan. And that includes things like being able to use a wet bulb globe thermometer, and being able to make the call when it comes to whether there's a National Weather Service heat advisory, or there are heat hazards present. That triggers a whole series of actions throughout the remainder of your HIP. And so supervisors really need to be on top of everything that's in your HIP. And those individuals will represent the leadership in the event that those hazards occur, or let's hope that an emergency doesn't present itself. But if it does, those supervisors are the ones who are going to be coordinating those efforts, and they really need to lead by example, and doing so is going to help engender not only this culture of awareness and proactive approach when it comes to preventing heat illnesses, but it's also going to help address that issue of underreporting we talked about earlier. If workers know how to recognize the signs and know that they've got easy to use systems to implement, not to implement, to report those hazards to their supervisors, and that their supervisors are going to be responsive to those concerns and take action. That is all going to just kind of undergird this culture of greater awareness and proactivity around heat illness prevention in your workplace. And you're going to see less illnesses and health effects as a result. So that's why I've got this one called out here. Lastly is record keeping. I know we're getting close to the top of the hour, so we'll get through this quick. Um, One of the big requirements in the proposed rule and in several of the state requirements is documentation of work conditions, not just when there's an incident or an injury or a recordable or anything like that, but all the time. Now, this is mostly applicable to indoor work environments, but depending upon your state, it may be required for outdoor work environments as well. Basically, what you need to be doing is monitoring the temperature throughout the day, throughout each workday, and recording that somewhere and maintaining that for a minimum of 6 months. Now that look back period or the record keeping period might be different depending upon which state you're in, um, but as minimum of 6 months is a best practice. So you're going to be using your wet bulb globe thermometer to measure that regularly throughout, at least twice per workday, every day. And so you need to make sure that you've got a system in place to capture these readings. And then, sort of your more run-of-the-mill record keeping practices. Of course, we have our OSHA injury and illness reporting requirements. If you experience a heat-related fatality in the workplace, you need to report that to OSHA directly within 8 hours. If you experience any sort of hospitalization as a result of a heat-related illness, you need to report that to OSHA directly within 24 hours. Also, when it comes to injury and illness record keeping, your OSHA forms 300, 301, 300A, any recordable illness beyond first aid needs to be documented in those logs. And so, for example, if someone starts to show the sign of heat exhaustion, but you get them out, you give them cool water, you get them cooled down, you get them back to normal body temperature, that would effectively qualify as first aid, and that wouldn't necessarily qualify as recordable. But if you need to call an ambulance, or if you need to even call a doctor to ask, medical consultation is one of the criteria for recordable injury and illness. If you have to call a doctor to ask what to do, that's recordable. And then lastly, our electronic record keeping requirements through the OSHA ITA. If you're in one of those covered industries under the ITA record keeping requirements and you experience a heat related recordable illness, you need to make sure that you're reporting that to OSHA's ITA as well. And then more of a best practice thing here. When you're doing, if you experience an illness, whether it's recordable or not, even a near miss, you want to make sure that you're performing an investigation to find out what happened, why that, maybe it was a near miss. Why didn't it become a full-blown heat-related illness? You want to understand what happened, what went wrong, how to prevent it next time, right? So as you're recording information about near misses, about recordable or non-recordable heat-related illnesses, make sure that in addition to all the other things you're usually capturing with your investigations, you're also capturing wet bulb globe thermometer measurements, ambient weather conditions, information about worker acclimatization status and fitness level, and then the presence and effectiveness or function of any controls you might have had in place that were designed to prevent that condition or that incident from occurring, but maybe you had a failure in some part of your control processes that led to that incident. So documenting everything is going to give us a greater data set to work from when it comes to being able to identify risks and take action to prevent them in the future. The last thing, I'd mentioned this briefly before, medical monitoring. In a nutshell, um, if you have workers who are exposed to heat stress, you'll want to consider doing periodic medical exams to evaluate worker health. uh, fitness, heat tolerance, and other medical factors that could impact their ability to work in hot environments, and that could impact their level of risk when it comes to heat stress. Um, this is going to help you to determine how you should adjust work schedules or acclimatization programs or just job assignments, and other controls that you're ultimately going to implement. A less fit worker might require a greater acclimatization period than a more fit worker, just as an example. So, um, if you really want to get into the nitty gritty of protecting workers from heat risks, this is something you need to consider. So the hip brings this all together. Everything that we've just talked about up to this point all goes into the hip. This needs to be written, needs to be documented, it needs to be made up to date. Just like, let's say, your written hazard communication program plan or your written emergency response plans, any other plans that are required under regulations, spell everything out, spare no detail. You'll thank yourself if you ever receive a visit from an OSHA inspector or other regulator who comes looking for this plan and you've got it accessible, up to date, and comprehensive and complete. All right, and that brings us to our final poll question. I know we're very close to the hour. Hopefully, we'll have a little bit of time left for some Q&A. But what I want to know before we all part is, what systems and technologies does your company currently use to administer your HIP, should you have one? Um, and I guess if even if you don't have a formal HIP, just any heat-related illness prevention practices that you have in your workplace. So it could be strictly paper-based documents. Maybe you use Word documents, spreadsheets, emails, or some combination of the two. Maybe you've got a software system that some enterprising young safety professional built for your company years ago, and maybe you're still relying on that. Maybe you've got a formal purpose-built safety management software system that you use, or maybe you're not using any of these. Um, Whichever you use, we'll go ahead and take a look at the results right now. And this is not surprising. With most other aspects of EHS management, we do still see a lot of folks out there still relying on paper for a lot of things, um, or basic desktop software applications. And no surprise, most people are using a combination of both. Um, some folks, interestingly, have an on-site, on-premise software application that maybe they've built themselves or patched together with some other existing software products, and a similar number who use a dedicated safety management software. And then also, a surprising number of folks who don't have any of these systems in place. Maybe that's because they don't have a heat illness and injury and illness prevention program, or maybe they don't have heat hazards in the workplace and they're just here to enjoy the presentation. But interesting results. With that, um, I just want to take one moment to mention how software can help you to implement the various aspects or various components of a really well-rounded, comprehensive HIP. When it comes to your program scope, it's all about determining what regulations apply, putting those all into a centralized location where you can reference what regulations are covering your organization and your workplaces, and making sure that those are up to date all the time through something like a regulatory content integration feature that automatically updates requirements and updates your inspection and audit checklists as new requirements are published. And then just generally documenting your HIP and maintaining it, keeping it up to date. Responsible personnel and systems, making sure that you've got something in place to assign users to roles and responsibilities within your HIP, being able to track implementation and performance across locations. With heat hazards, we talked about JSAs a little bit, and being able to make sense of the information that you're getting out of your JSAs, not just a single JSA, but imagine JSAs for every job across every workplace, and being able to pull information about that to look at and identify trends around heat hazards and heat related illnesses. When it comes to implementing heat hazard controls, uh, such a system can make it easier to select and assign controls, verify that they're effective, and systems like Velocity HS even offer artificial intelligence and machine learning integration that allow you to, based on the level of hazard, the type and level of hazard, provide expert control recommendations, so you don't have to, spend tons and tons of time developing your controls from scratch. Of course, coordinating your emergency response and planning systems, incident investigation, root cause analysis, a whole learning management system for your training program, and then injury and illness record keeping systems as well. So, with that, I'm going to hand it back over to Alan. I know we're very close to the time. In fact, we are at time. But if we have any questions, I would welcome them. And if folks want to stick around, I'll be here.
Yeah, thank you so much, Greg. Before we start the Q&A, we want to remind everyone of the evaluation survey we're asking you to complete. Your survey will open in a different screen after this webinar. Your input is important because it does help us improve our future webcast. Yeah, so our first question is there a definition of how an employer knows whether they're affected or not by state level regulations or even any pending federal regulations?
Well, you want to make sure that you're, of course, looking at the language of the regulations. You know, go to your state's occupational health and safety management agency or authority website, and look up heat hazards. Those maps that I showed you earlier of the United States, where there are um, existing and proposed legislation. um, that was a great resource. I think the citation's right on those maps. You can find that website to go to, and it'll let you explore those requirements for each state individually. But most often, the requirements are triggered by industry, um, and depending upon whether you have indoor or outdoor operations, those are really the two big kind of company criteria that are going to just determine whether or not you're covered. Um, and then if you are covered, the requirements don't kick in until you hit those action levels, the lower and upper temperature action levels as well. So determining that really requires an accurate temperature reading of your work environments and where jobs are performed. And as I said earlier, we can't control the weather. You really need to be prepared for one of these, a heat advisory or a high heat condition. So making sure that you've kind of got everything staged, ready to go, should it be required. Um, and maybe even having it in place no matter what, even if there is no heat hazard per se, is really your best practice. But again, yeah, just to make sure whether or not you're covered, look to your state's regulations, look at maybe any specific list of covered industries, where it comes to, or when it comes to the OSHA NEP, look at that Appendix A list for the industries. But always keep in mind that, with the general duty clause, any heat hazard in any workplace can be cited at any time. It's not restricted to those industries. But it's a good bet that that's what inspectors are going to be looking at, or who inspectors are going to be looking at. Um, so yeah, just make sure that if you're on that list and you're in a state that has a requirement, be prepared for to meet all those requirements.
It's like we have time to squeeze in one more question.
Sure.
So we have field sales employees that work their territory from their homes. They drive their personal vehicles to their customers' facilities. How would we manage a HIP program for these employees?
So from some things that I've seen in the past, generally, remote work and work from home employees are not covered under most um, occupational health and safety standards, um, when they're working in their home. Now, once they leave the home and they get in their vehicle to perform duties related to work, that's when the requirements kick in. And so even if they're in their personal vehicle, if they're traveling for a work-related purpose, they are covered by, any number of standards and requirements, including applicable heat illness prevention standards. So yeah, if they're mobile, they're sole or lone workers. That's why I was when I was showing that industry breakdown of incidents by industry, we see utilities and transportation related industries are experiencing the highest levels because they're most often remote and they're most often lone workers. Um, Establishing some sort of system to oversee, communicate the training, provide training to workers, and then um, it may fall on the worker themselves to monitor whether or not there is heat hazard present in their job. Now, being prepared with, hazard precautions or hazard controls, and providing those, or at least educating that lone worker, that remote worker, in how to apply them, is should be part of your training, and it's also your responsibility to provide those controls for the worker. Um, but that's a tough situation. You can't improve the ventilation for somebody who's not on your work site. You can't necessarily provide hydration or rest for them if they're by themselves, and it's up to them whether or not they're experiencing symptoms of a heat related illness and whether or not they need a treatment for it. Education is key, I think, in that situation, making sure that workers know the signs, how to prevent um, a, a heat-related illness, and how to keep it from escalating, um, and then providing them with the resources and the systems to communicate those risks to you, as a supervisor or as an EHS manager, or somebody in that type of competent person role overseeing the HIP. Um, just prepare them as well as you can, and give them a way to communicate those risks to you. Um, you can't. It's like the old saying: you can lead a horse to water, but you can't make him drink, right?
Well, thank you so much, everyone. Unfortunately, we have run out of time today. This ends today's Safety Health Magazine webcast. I'd like to thank Greg Duncan, the entire team from our sponsor, Velocity EHS, and of course, all of you who joined us today. Take care and have a safe day.